Namaste and good afternoon. Welcome to today's Facebook Live session presented by Apollo Hospitals. Dr. Srinidhi Chidambaram here. I hope you're all doing well and staying safe. As COVID-19 slowly eases into milder versions and life is beginning to resemble what it was pre-pandemic, another infection has been making news of late, monkeypox. Monkeypox is an infectious viral disease caused by the monkeypox virus. It leads to rash and flu-like symptoms. It's a zoonotic virus, which means that it spreads from animals to humans, also spread from person to person. Monkeypox was most common in Central and West Africa, but in May 2022, health officials began to see it in several countries outside Africa. And India saw the first case of monkeypox recently. And the World Health Organization has also recently declared monkeypox as a public health emergency of international concern. Point to be noted that a public health emergency is an extraordinary event that poses serious public health risk. It's different from a pandemic like the one caused by COVID-19, which is more like a global outbreak causing large numbers of people being affected and large number of deaths. But anyway, owing to the growing number of cases worldwide, the growing number of mentions about it all over the media, all over social media, it's important to know exactly what monkeypox is and should we be concerned and how concerned should we be. So to discuss this, I'm very happy to welcome Dr. Ram Gopalakrishnan, who is a senior consultant at the Institute of Infectious Diseases at Apollo Hospitals, Chennai. Dr. Ram Gopalakrishnan completed his MBBS from the Madras Medical College, MD from PGI Chandigarh in Internal Medicine, and also the MRCP from UK. He's American board certified in infectious diseases and internal medicine. He has also specialized in tropical medicine and travelers' health from the American Society of Tropical Medicine and Hygiene. And he has been very active in teaching and mentoring as a adjunct professor and distinguished clinical tutor at Dr. MGR Medical University and at the Apollo Hospitals Education and Research Foundation. He's an author of over 87 journal publications, 9 book chapters, and has delivered over 270 lectures. Welcome, Dr. Ram Gopalakrishnan, to this session about monkeypox. So you tell us, should we be worried?
Yes, you should be worried. However, to put things in perspective, I wouldn't worry about monkeypox as much as I would about COVID, at least right now. And there's a simple reason for that. Monkeypox is probably far less transmissible than COVID. Having said that, please don't close your eyes. Keep your eyes and ears open for the latest on this topic, because this is just around the corner in India. We've just had 4 cases in India, and therefore keep your eyes and ears open.
So could we begin by discussing what is monkeypox exactly?
Yeah, monkeypox actually is a misnomer. The disease actually has nothing to do with monkeys. It accidentally infected a few monkeys in 1957. That's when the virus was discovered. All animal cases are actually in non-monkey animals, typically squirrels, typically large rats, and these are all found in Africa. And in the 1970s, it came out as a zoonosis. What is a zoonosis? It's something that comes from animals or an environmental reservoir. People in Africa, and typically in Western Africa, in Congo, Zaire as it was named then, would go into the jungles to hunt meat, bush meat they would call it, and they would come into contact with this virus when they actually kill these animals which carry these viruses without many symptoms in the animals. That is how the disease first came to attention. It is something similar to smallpox. The rash that it causes is quite similar to smallpox. You will remember that in the 1970s, smallpox was still around, and we would launch vaccinations worldwide till it finally became eradicated in the 70s and 80s in various parts of the world. So that's how the disease came to attention.
So are there different types of monkeypox of varying degrees of severity?
Yeah, so traditionally monkeypox has been of two so-called clades or types. The Western African one, which is seen in some West African countries, Gambia, etc., is less severe, less virulent than the East African. I wouldn't say East African, but it's a little east of those West African countries, such as Congo, former Zaire, etc. The strain that we have now is evolved from the West African one. So of late, the new nomenclature suggests we call them clade 1, clade 2, clade 3. Clade 1 is what is being seen in Europe, the US, and the first few cases in India, whereas clade 2 is the former West African strain, clade 3 is the former Zaire or Congo strain.
So is this a combination of both the strains that we see now, or I mean,
Right now, what we are seeing is evolved from the West African strain. That is the former West African strain. That is what we call clade 1. Those actually constitute the imported cases that are being seen in India. Having said that, there is some very recent research which suggests that even in the West, there are two subtypes. There is an A and a B. And it seems that what we are seeing here in India is the similar subtype as the cases that have been reported in the US. And therefore, there are some subtleties to this. We'll obviously know more as we move along.
So what are the symptoms? Like when should one think that, you may be having monkeypox?
Right. So the symptoms of monkeypox are basically threefold: fever, body pains with, say, lymph node enlargement. Lymph glands are the small glands that swell up all over your body.
And it turned out to be chickenpox. So how do you really differentiate between these two?
Yeah, so if you look at the traditional signs and symptoms, they're quite easy to distinguish. For instance, in chickenpox, the disease typically involves central parts of the body more, the body, whereas in monkeypox, it typically involves the palms and soles. The lesions in chickenpox are all turn different, in different stages. For instance, you can have a small bubble which then heals over and forms a scab at the same time, whereas in monkeypox, they all evolve along at the same time. In other words, at one time, you will only see bubbles or vesicles. When they all heal, they all form scabs. This is the traditional classification. Having said that, the most recent monkeypox outbreak, which we are seeing right now, has shown that these lesions can be in different stages at the same time in different parts of the body. So as we speak, the textbooks are being rewritten as far as the latest outbreak goes, and therefore it's important to keep the disease in mind in anybody who has any unexplained rash, fever, or lymph gland enlargement. You can't go by the traditional descriptions anymore.
In fact, there was even another study or something in the UK, I think, where they said one of the presentations was actually rectal pain, and there was some, I don't know, are there any such unusual symptoms that?
Yeah, absolutely. Yeah, there was a recent paper in the British Medical Journal which described a lot of genital lesions with this particular outbreak of monkeypox. It behaved like a sexually transmitted disease. Many people had very prominent rash in the genital area. They had a lot of rectal pain because the rectum, or the lowermost part of the intestinal tract, was very involved. In fact, in some patients, it was so bad that they had to admit patients to hospital just to control the pain. So as you can see, it's changing. It's behaving more like perhaps a sexually transmitted or a disease which is transmitted by very close contact. The rash is largely in the genital area. It doesn't progress in the classic mode it's been described to progress in the past, say in Africa. So it's changing a lot. That's why a very high index of suspicion is needed to make the diagnosis now.
So who's at risk? Is it like anyone can get monkeypox, or are there any vulnerable groups?
So the first thing is you need to be from a country which has reported outbreaks of monkeypox. Typically, that would be Europe and US. As many as 70 other countries have actually reported this, but in far fewer numbers. In India, we've had about 4 cases so far. And if you have not traveled to those countries, you need to be in close contact with somebody who has been diagnosed with monkeypox or who has very typical symptoms of monkeypox. That is number one, where you've traveled. Number two is, what are your risk factors? If you're in a group that has that high risk for sexually transmitted disease, for instance, multiple sexual partners or men having sex with men, that increases your risk manifold. Thirdly, you have to have a vesicular rash. What does a vesicle mean? It means a rash which forms a bubble on the skin. If you have any type of vesicular rash which cannot be explained by another disease, for instance, chicken pox, you need to think of monkeypox. And finally, the typical triad of symptoms: fever, lymph gland enlargement, and vesicular rash. Whether you've traveled or not, whether you've come into contact with anybody or not, monkeypox should be there both in the healthcare professional and the patient's mind.
So is it also that hospital workers and healthcare workers are at risk?
As of now, in the vast majority of Indian healthcare settings, no, because we have had only 4 confirmed cases so far. As of now, no. But certainly, as was the case just before the COVID pandemic hit India, healthcare workers will certainly be at risk. So if there is more widespread reporting or transmission of this disease among patients, yes, certainly those in the front lines, doctors, nurses, healthcare technicians, phlebotomists, etc., will certainly be at risk and therefore should be candidates for prevention, whatever that is, whether it is protection, whether it's a vaccine. Healthcare professionals should be at the forefront of that.
So protection, as in as this has come so closely on the heels of COVID, now we do have sporadic. I mean, like, it's not so stringent as before, but people are still wearing masks and still hand hygiene is on. So the awareness is better now on hand hygiene and on usage of masks. But do they really protect against monkeypox? And is it as, I mean, you said it's not as contagious like that from droplets as COVID. So what should we do really to protect ourselves?
Yeah, so if you're following COVID precautions carefully, then you should be protected against monkeypox. For instance, if you're a healthcare professional, if you're wearing your mask before touching the patient, if you're wearing gloves, if you are covered with any form of protective dress, gowns, etc., then you're protected. The true risk comes when you don't suspect the disease. For instance, a patient with monkeypox walks in to have a blood sugar done. The lab technician does not know this and comes into close contact with that patient. That is a risk. How is monkeypox transmitted? We know that it's transmitted by large droplets, which is not as efficient as the small droplets and sometimes aerosols that you see with COVID. We also know that it's transmitted by person-to-person contact. So that is why when you touch somebody else's skin, make sure you're wearing gloves. That is important. And finally, there is emerging evidence that it may be transmitted sexually. This is what we have discovered in the latest outbreak that we're seeing in Europe, US, and the few cases in India so far.
So in a person, supposing somebody has monkeypox at home, then a person who's being looked after by a family member also, they need to be careful handling secretions and so on, right?
Absolutely. So that patient, if that patient is in a private room all by himself or herself, then there's really no risk because you really have to come in close contact. It's not like COVID, where you can cough and transmit the virus even across a room. You really have to come close within touching or physical distance. One important difference is COVID does not survive efficiently on inanimate environments. If you recall, we were worried about the laundry, the linen, the newspapers, the etc. in COVID early on. That's been disproved. On the other hand, we know that the monkeypox virus can survive on linen and inanimate objects for a period of time. It's much more resistant to drying out, disinfection, etc. So touching the bed linen of somebody with monkeypox can give you the disease. Therefore, be careful. These patients' linen, household articles should be carefully disinfected.
So these secretions, are they just the secretions from the rash, that is from the vesicle, or is it also through they do have cough and runny nose as well, or is it just through the fluid?
They don't have respiratory symptoms typically because monkeypox is not typically a lung disease. Most of the transmission occurs by close contact. You come in contact with somebody's skin, you're in the same room, virus particles, because these are all open rashes. COVID does not cause a skin rash in the majority of patients, whereas these patients have open vesicular rash from which virus drops off in large particles. So you have to be in really close contact with these patients to get infected.
So not really through the coughing and...
Not really through coughing. Typically, monkeypox patients don't cough. It's not really a lung disease.
Also, is it that, once you get monkeypox, like smallpox, it confers lifelong immunity? Do we know that yet?
That's right. So unlike COVID, where you can get infected again and again by different strains, or we all know that the Omicron strain is doing the rounds right now. And even in that, you can get reinfected in COVID. It is exceedingly unlikely that you will get reinfected by monkeypox, because the immunity you get once you get infected is typically lifelong. Like, for instance, chickenpox or smallpox, either if you get infected or if you get the vaccine for smallpox.
So if somebody comes to the hospital with symptoms of monkeypox, what are the stages? What are the diagnostic tests, and how do you confirm it? And then how is it treated?
Yeah, so the first thing is, when you suspect somebody might have monkeypox, you take appropriate precautions. You isolate the patient, whether it's an outpatient or an inpatient setting. A single room is more than good enough until you know for sure it's appropriate for healthcare personnel to wear the exact same things you would for COVID: the mask, the gloves, the gowns, etc., that you would. After that, you send off samples to a reference laboratory, which your state government will guide you to. In India, the National Institute of Virology is the reference lab where the samples are sent. They are routed through the state government. Most of the time, we take samples from the skin lesions of these patients, because they typically have many skin lesions, and the diagnosis is readily made because it teems with virus if you send it to the appropriate facility.
And then is there a treatment for it as such, or is it symptomatic?
Yeah, well, there is a treatment, but the fact is, just like COVID, the majority of patients don't need treatment. It's a self-limited disease. There are very few cases, very few patients who die outside of Africa. Most of the deaths happen in Africa, probably related to suboptimal medical care, the fact that many children may be involved, etc. But in the most recent outbreaks, there have been very few mortalities. And that is very important. It's a self-limited disease. It gets better over time. Unfortunately, there are some complications you have to watch out for. So patients who are severely infected, for instance, severe rectal pain or widespread rash, or for any reason, if the patient is unstable at home, or just for infection control purposes, the government may ask you to admit and isolate. So these are the situations where you have to, in general, the treatment is all supportive. You just support them, you make sure the rash heals up, that they don't get secondary bacterial infections, and they improve over a period of 3 weeks or so. There are a couple of antiviral drugs available. The most efficient is one called tecovirimat. It's not available in India as yet, but it has been used. It is available in the West. There's a second drug called brincidofovir, which is also not available in India, but has some side effects to the liver. So these options are available for patients who have severe illness.
And how long should they isolate from the rest of the family members?
Usually till all the lesions scab off, right? And that typically takes about 3 weeks. So unfortunately, it's a long period of time when they're communicable to others. So you have to isolate them for usually 3 weeks till everything is scabbed off. You can be sure you're not going to transmit.
There is also this belief that, somebody has been vaccinated against smallpox in the 70s. So people after that, I don't think it was stopped. So are they more protected? Do they have any kind of immunity against?
Yeah, well, yeah, it's thought that the smallpox vaccine is about 85% cross-protective against monkeypox. Not 100%, but 85%. And
but
remember,
even after all these years.
Yeah, and remember, we all got vaccinated. Those of us who are vaccinated for smallpox got vaccinated. For our immune memory may be quite low right now. So just because you had smallpox vaccine in the past, just treat monkeypox exactly the same. It can infect you as well.
And what about a vaccine for monkeypox? Is it available? Is it going to be offered?
Yeah, there are two vaccines available abroad. The best vaccine is one called Jynneos. It's known by different brand names in Europe. But this is a modified Ankara virus vaccine, which is actually a replication deficient vaccine. What that means is it's fairly safe. It's not something that keeps multiplying and can cause disease itself, like, for instance, the chickenpox vaccine. So it's fairly safe. It was approved in 2019 for prevention of both smallpox and monkeypox. Even before the current outbreak, you require 2 doses, 4 weeks apart, and there's a big shortage of vaccine. We've heard news that people are queuing up in the West just to get this vaccine, and there's a big shortage of vaccine. So it's not likely to come to India anytime soon. There's a second vaccine, an older generation vaccine against smallpox, which is ACAM 2000, a lot more toxic. It's a more live virus vaccine, so unlikely to be used against monkeypox, which rarely kills people. The government of India, in collaboration with ICMR, has announced that they are working on a new vaccine. Hopefully that will come to fruition. It will certainly reduce costs, but we don't know when that will be available. It's going to take time.
And as we said, this is large droplets and it doesn't really spread through cough. So restrictions like, avoiding public, large crowds. So these are not that relevant, are they now? Or is it still?
No, for the average person, you are not going to get monkeypox unless you come in close contact with somebody with monkeypox. In other words, fever, skin rash, lymph gland enlargement, etc. So it's not something you need to worry that you will get in the cinema theater or you're going to get at work, etc. It's physical contact, which is largely the way you get this disease. So it's not something you need to panic about. Like, for instance, when COVID first struck, we didn't know anything about it. It's not likely to be as widespread transmission or as transmissible as COVID is.
But is monkeypox also likely to be asymptomatic? Can it happen without any symptoms at all?
Well, if you have partial immunity, say if you are smallpox vaccinated in the past, then you may have mild disease, but we don't know that for sure. In the most recent papers on the outbreak in the West, in UK and the US, many patients have had 1 lesion, 2 lesions, just 1 or 2 rashes. On the other hand, some people have had up to 300 distinct spots, rashes on their skin, as well as high fever, etc., severe rectal pain. There have been some complications as well. So there is a wide spectrum of disease. So you never can say. Each individual patient is different. So just because you have 1 spot on your skin certainly doesn't mean it can't be monkeypox. You need to test and rule it out.
All right. Is there anything else that you would like to add, Dr. Ram?
Well, monkeypox is around the corner, but it's not something you need to panic about. It's not something you need to rush in line to get vaccinated about. It's not something that you're going to pick up, whether you go to work or school or college. You're not likely to pick it up from there. At the moment, it appears to be people most at risk are those with high-risk sexual behavior, multiple sexual contacts, or those who, men having sex with men. So if you are in those categories, you need to modify your risk factors accordingly, reduce your risk accordingly. But otherwise, the general population is not likely to see this disease. We can't say what's going to happen 6 months from now, but if the government is efficient about limiting disease and rolling out vaccine to, say, healthcare workers or high-risk people, as and when a vaccine comes out, hopefully we'll be able to contain it. Only time will tell.
Right. So thank you, Dr. Ram. So viewers, I do hope that you found this session informative, and I do hope that you got the right information about monkeypox now. As international travel becomes more common, viruses that were once fairly confined to one geographical location can now more easily spread all around the world. So it's not just monkeypox. There are a lot of infections that could become more prevalent across the world like this. So it's always important to be aware and observe some basic rules of hygiene, and you can protect yourself from these infections without any misinformation and panic if you read up about it and if you get the right facts about it. So there's no need for anxiety, but there's always room for adequate precautions so that you don't get any infection at all. So same holds good for monkeypox. Please subscribe to our YouTube channel for any further information, latest information on trending healthcare topics. And if you have any more queries, you know that you can always reach out to us 24/7. Thank you. See you soon. Namaste.